Hello and welcome. This is Dr. Jerry Cuomo. I'm now recording a lower right rescue case. This is a Branemark Estheticone fixed screw retain bridge. We said before it was teeth numbers 28, 29, 30, 31. It's really 30. It's going to be 29, 30, 31, and 32. This happens to be a 2-unit bridge. We're going to go ahead and rinse that now. So again, we didn't find out that these are Estheticone abutments until we contacted the company. We were able to do the research. It did take a little while to do that, but we did manage to get there and get the right parts ordered. Cleanser next. This is our cavity cleanser. Now we've placed these healing abutments because we were waiting on parts, and so now we're ready to do the assembly work. First things first, we'll take the first healing abutment out. Hopefully we've got everything perfected here. So I'm just going to tip you back a little bit. There we go. And open for me. All right. And it's always good to keep healing abutments just in case you need them someday. All right. The technique is basically no rotary instruments. Everything is hand scrubbed using tartar and stain remover. So first thing I'll do is just apply a little soap down into the threads. We found out that the threads are somewhat marred on the buccal side. Nothing we can do about that. It happened when the pieces were fractured. The fracture ends were rubbing up and down on them. So here's the first one. Looking straight down. We'll need a new mirror, please. And you can see it on the buccal side. Well, we're just going to switch our mirrors out. And we'll get one more mirror, please. Okay. All right. Okay, now we're just going to go down and take a peek. Make sure there's nothing hanging around the rim. Looks good. And we're going to just suction right down the middle. As noted earlier, all the bioburden was removed. We had a very meticulous method of removing them using bristle brushes, small little brushes. Okay, so I'm going to come off the patient. I'm going to go ahead and just show. This is what we ordered. It's the Estheticone 1 millimeter skirt on that. So here are the skirts. That's one. And so that screw is going to fit right down through the skirt, and then we'll tighten it down to 20 Newton centimeters. Open that up. All right. Slide that in like that. And that all assembles just like so. Now what we're going to do is take our drill. Actually, I'm not going to go in there with that. I'm going to take a hex and tighten it. A hex driver. I'll get that out. There we are. And go. And now we got to put a driver handle on that. Take that apart. Here we are. Driver handle. Alright, so here's the assembly. We're ready to go, and we're going to tighten this again to 20 Newton centimeters. So this is the screw that actually fractured, so it's going back in with a brand new screw. and skirts going in, and everything should line up nicely. So here we are, back together in the mouth. And we always go left first. You don't want to just start tightening everything in, so we start to go left. So counterclockwise, line it up. And just feel the threads go nice and easy in. Open up a little bit wider, perfect. Never forcing, always just let it go. Let it catch. Let's see. Okay, let me cotton plier. Let's see where we are. Here we go. It's all right. Get it to catch. Well, okay, let's find out what's going on here. So we slip underneath. I'll get the skirt off. Let's see if we can just start this with our hand threaded screw. Let's see. There we go. Let's just start it by hand. Yeah, no problem. It's going in nicely. So we know there's no problem threading it. It's just an angulation. So lots of play here. Should be fine. So just bear with me. Just going to go in again. The sleeve kind of blocks the view. So I'm going to just leave the scope over. I'm going to come off and look on the side and see if I can just line this up myself. And we'll try this once again. All right, so here we go. I may not be able to see this if that's all right. Let's just get it started. All right. So we steady everything. You okay? All right. Okay, so it's going in, should be going in now. I'm having a little tough time trying to get it threaded. Let's see. Well, some as easy as this is kind of difficult, so we'll try a different angle. Okay, we'll back it out again. I'm going to take a little bit of a break and see if I can do this and try to pick it up again. This is Dr. Jerry Cuomo.